10 to 15 years is there has been a great progress, especially with the introduction of free fetal DNA and the ability for us to isolate from the maternal blood. So how well are we doing it? It was first reported by Lowe in 1997. It originates from a trophoblast seen from 5 weeks onwards. So what we did not expect is that about 10 to 20% of the DNA in the maternal circulations are from fetal cell-free DNA. And the concentration of this increases as a gestation progresses, and it is cleared within 30 minutes of delivery. And there are several studies showing that the sensitivity for the Down syndrome is between 98 to 100%, with a specificity of 99 to 100%. So the detection rate is not only high for Down syndrome with a false positive rate of 0.9%, but it is also pretty good for Edwards syndrome, that is trisomy 18, and trisomy 13, which is the Fetal syndrome. But obviously, these are still issues. There are lots of issues with cell-free fetal DNA, especially if it is twin pregnancy, or is a failed results because it's an early gestation, or the woman has got high BMI, or whether if there was any impaired placentation, mosaicism, and if there's any genetic problem. So it can still be a problem. So this is just to show it, how free fetal DNA has become far superior in terms of screening for Down syndrome, as well as Edwards syndrome. So the detection rate, as I said to you earlier, is more than 99%. And then, you can see, you can ask a question, why do we bother doing the combined test anymore? So it's, but do you remember what I said earlier, that it identifies increased nucleotranslucency, and it is not just for Downs, it can detect other structural problem and genetic problem and the other aneuploidies, and especially PAPE in particular. What you need to know is low PAPE is associated with preeclampsia, growth restriction, and also stillbirth. So when a woman presents with low PAPE, we do screen them to identify whether they are at risk of developing these conditions. So combined test at 12 weeks. I thought, so these are, you can see how well when you combine all of them, you can improve your screening. I'm not sure whether you want to ask questions now, because I'm now going to move on to the next topic.
There aren't any questions, Lakshmi, but I thought of asking why bother doing the combined, but you already answered it. So is a cost comes there, the NIPT?
Yes, definitely. So there is a lot of, obviously they are very expensive, free fetal DNA. Still, even in UK, not all the hospitals offer that, but we at Barts Health, we offer them. But this is only for those women on the combined test if it is found to be high risk. So if it is more than 1 in 250, then they are offered this test. And it is expensive. It is, at the moment, it is charged £300 per test. So it is quite a lot of money. So for those women who wants to have it done, they can have it done privately, but with an NHS, only offered for those women found to be high risk.
For the benefit of people who are sitting for MRCOG, so